Good afternoon, everybody. My name is Samuel Durosharo, and I'm a senior lecturer at the Department of Animal Breeding and Genetics, Federal University of Agriculture, Avéll Obahama State in Nigeria. I work on the welfare and behavior of animals, poultry, and insects. You are all welcome to Animal Welfare Group Nigeria with the acronym AWGN. AWGN was founded in 2019 after a gathering of students and lecturers from the Federal University of Agriculture, Abeokuta, Ogun State in Nigeria. And this group has three missions. Our missions are to increase awareness about animal behavior and welfare in Nigeria, Africa, and the world at large. The second mission is to foster collaboration and networking among researchers who are in the field of animal behavior and welfare. The third mission is to educate the public on the importance of animal welfare. We meet every first and third Wednesday of every month to discuss issues that are related to animal welfare and behavior. And people from different parts of the world have presented on issues that are related to ethical practices, slaughtering, stress, cognition, neuroscience, welfare assessment, and behavioral genetics in animals. And when I say animal, I'm talking about livestock, wildlife, pets, insects, and fishes. Today's presenter is Avéll Obahama from University of Guelph, Canada. She'll be talking on identifying and interpreting equine affective states, a focus on pain assessment. I'll be the host and the moderator for today's webinar. And before she starts her presentation, if we have any question for her, let's drop it in the chat box. She's going to answer all the questions after her presentation. I'm going to be reading a short bio, after which she's going to start her presentation. So Avéll is a first-year PhD student at the University of Guelph, specializing in equine exercise physiology. Her academic background includes a master's in animal welfare and behavior, where she focused on equine facial expression, and a bachelor's in equine management. She has been passionate about horses since early childhood, not as a rider, but as someone who values their presence and individuality. She holds a deep respect for horses as sentient beings and hope to promote education and research that support mutually beneficial horse-human interaction rooted in empathy, understanding, and welfare. Our presentation today focuses on identifying affective states in horses with an emphasis on pain assessment and recognizing the overlap between pain, discomfort, and psychological stress. Over to you. You can start your presentation. Thank you so much.
Yeah, thank you for the introduction. That was very lovely. Yes, my name is Avéll. I'm presenting from Canada. I am currently, as he said, a PhD student at the University of Guelph, and I don't have a lot of time for this presentation. It's quite a big topic, but I hope that by the end you still have a comprehensive understanding of it. So we will start first with what is pain to begin with. So pain is defined as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. This distinction is very important, the emotional aspect, because this implies that pain is not solely a physical phenomenon, but it can also encompass mental suffering. So some conditions that may only have mild discomfort, such as itchiness, that can still warrant intervention, pain intervention, if there is like prolonged emotional suffering associated with it. And so because of that emotional aspect, pain is considered an affective state. If you don't know what an affective state is, it's essentially a subjective experience that are valenced. And valence just means whether the experience is positive or negative. Affective states can be short-lasting responses to specific events. So it can be fear from being chased, or they can be long-lasting moods, such as everyday anxiety or contentment. And there are homeostatic emotions. And that is just referring to homeostasis, which is the body's ability to maintain a stable physical environment. So, for example, we see some affective state examples at the bottom here. A homeostatic emotion would be thirst or hunger. So, those are affective states that maintain the body's physiological environment. That's a homeostatic emotion. Then some negative experiences might be pain or dizziness. Positive experience would be satiety. So they eat well, they're not feeling hungry. Um, Goal-oriented, they're engaged in their environment. Those are just some examples. And where affective states fit into welfare is essentially in the five domains model, which is now what has replaced the five freedoms, if you're familiar with those. But it is the fifth state. So all the other states, nutrition, environment, health, behavior, all of these influence the horse's affective state, and that's what encompasses the fifth domain, which is their affective state, their thirst, their hunger, their anxiety, fear, pain, distress, etc. And that will determine their welfare state, if there's a net negative or a net positive. And welfare is important in agricultural systems because in poultry systems, if you have poor welfare, you might see reduced egg production or mortality of chicks and chickens. In cattle production, you'll see reduced milk production, poor fertility and mortality. And then in swine production, you'll see poor fertility, low birth weights, and mortality. Moreover, there is a positive correlation between a customer's willingness to pay with the company either having welfare certifications or welfare statements. So we can see this bright yellow line here. If the product has both a certification and a welfare statement, then customers are the most willing to pay for their products compared to others that don't specify anything about welfare. But when it comes to the equine industry, we see time and time again that horses that are in pain or distress can still win competitions, and they are rewarded for doing so. Um, a horse's affective state can strongly influence how pain is experienced and resolved. And so if there's no focus on this topic and the horses are continuing to be treated in this way, they're going to suffer way more than they would if we were to try to create a positive relationship with the horse. And what I was talking about before you guys joined is, we've really taken the focus away from the horse in equestrian sport. We need to start seeing the horse as our partner or the center of equestrianism rather than a tool that we can use. And when we start focusing on the athlete rather than the horse, this is when situations such as the ones photographed are ignored or overlooked. But a horse's affective state, so if they're in a negative affective state, such as fear, frustration, or genuine pain, such as lameness, then that can slow the recovery of the body because it suppresses the immune system. But in contrast, if they are in a net positive affective state, such as comfort and relaxation, and they feel safe, then even if they are in pain, that can still help facilitate wound healing, and it can buffer pain responses. So now we're going into the main point of the presentation, which is how do horses communicate their experiences, or how can we identify these negative affective states? When it comes to pain specifically, there are a number of pain assessments that are out there that are used for various different types of pain. And I'll go into the pros and cons of that. So if we see on the side here, like the very first one is composite orthopedic pain scale. So we know that that's going to be related to bones and that kind of pain. But something like the horse chronic pain scale, that as the name suggests, would be chronic pain, and that can manifest very differently. But I will go into that more thoroughly later. So various assessments have been developed, and they use a combination of physiological parameters and observational parameters. While there's no single method that's universally applicable, advancements in pain assessment tools have enhanced the overall ability of veterinarians, caregivers, and researchers to identify and treat pain effectively. And so physiological parameters, historically, they've been used primarily in veterinary practices because they can diagnose acute pain responses, sometimes chronic responses. However, these methods can be inconsistent due to non-specific responses to pain, and I'll go more into that, but they're not very specific. They do let us know that potentially something is going on, but let's go into it more in depth. So the physiological parameters, as you may have seen, were heart rate, respiratory rate, temperature, and involuntary body function. So that's sweating and gut sounds. And so these physiological indicators do have essential role in potential health issues and monitoring the horse's overall being. These are things that you should be looking for on a daily basis. And changes in these parameters might signal underlying illness or symptomatic imbalances that may require veterinary attention. But it's important to recognize that not all health conditions resulting in changes in these parameters directly relate to pain. So something like infections or metabolic disorders, or other non-painful conditions can cause a shift in all of these parameters that don't necessitate pain management. Vital signs are activated through the sympathetic nervous system as a flight or fight response. And so when this response is activated, the body will undergo various physiological changes to prepare the body as suggested to flee or to fight. And so therefore, these can also change when the horse is stressed, and your own presence as the researcher or the examiner, or the methods that you're going to be imposing on these horses, whether it's the examination or the treatment, those themselves can influence these parameters as well. So they're highly sensitive. They are not specific at all. And while they may be good at validating the observations that you have, as standalones, not too effective. Knowing this, there are some new variables that are coming out of these. So heart rate, for example, there's now heart rate variability, which can see the difference between the sympathetic and the parasympathetic nervous system and let you know if the horse is anxious and stressed or if they're calm and resting and digesting. For temperature, now there's some research in ocular temperature, which is temperature of the eye, as a potential pain or stress indicator, but that needs some more validation research to actually be considered a reliable indicator. Now, the total postoperative pain severity index, or TOPSI, is the only method that has a unique inclusion of hormones. Um, Hormones do provide valuable insight into the body's response to pain, but you're going to face similar challenges when it comes to sensitivity and sorry, the specificness of these hormones. So, and also testing for them is quite impractical, even in a research setting where it's very controlled, because they do have different peak times, and they're also influenced by environmental conditions, genetic predispositions, physiological states. And if you're looking at multiple hormones, they might not line up with when they peak. So, for example, adrenaline will peak within seconds and it returns to baseline within 10 minutes. Noradrenaline does also peak in seconds, but it takes longer to return to baseline, so about 95 minutes. If you're trying to view that with, let's say, cortisol, that doesn't peak until 30, anywhere up to 60 minutes, you're going to have a lot of discrepancies because your adrenaline is going to be gone by the time that cortisol starts to show up. So it can be a little bit impractical and challenging. Also, these hormones are very sensitive and they, as I said, require immediate sampling. Cytokines, they're good for inflammatory processes. They take a while to peak, they take a long time to return to baseline. Um, but it's also, uh, as I said, there's overlapping hormones with this. So cytokines can be very hard to test for because they take so long. And then when you're testing for this, you're really just seeing, okay, is there inflammation? I think hormones do have a place in pain assessment and affective state observations, but more so in the sense of validating either what you're seeing, or I would even just argue to understand the physiological process that is happening. And that's also because hormones do, a lot of them do fluctuate with the circadian rhythm, and they have multiple purposes in the body. There's no hormone that is only for stress. Maybe it only shows up during stress, but it's for a specific reason, right? So, my current research, we are looking at inflammation in the intestinal tract of the horse. And what we're seeing from the research is that serotonin and dopamine do have quite a strong influence on the inflammatory cascade that's happening in the gut. And if you know anything about serotonin and dopamine, is that those are typically the happy hormones, or something that could indicate a positive affective state. But if they are significant in the inflammatory response, then clearly there's dual meaning there, right? So it can get quite confusing when you're using hormones. When you look at the literature, cortisol is the stress hormone. It's the one that you're going to see the most. But to be honest, it doesn't really tell you anything. Cortisol is used by the body for a number of things. Just as the rest, it's influenced by the circadian rhythm. It's highly sensitive. If you're looking at acute stress, you might want to use plasma, so in the blood, or salivary sampling. It's easy to collect, but hair and fecal sampling might be better for chronic stress. It can show you a more prolonged period of cortisol elevation, but as I said, it's not really going to tell you anything. And I think now research is starting to see that cortisol maybe isn't as helpful as we thought it was, and they're starting to shift away from using it. Moving into behavior, which is how what we're actually going to be observing, and honestly, the most practical. You can stand in a field and watch a horse, but I'll get into the challenges of that separately. But with the pain assessment methods and a very nice literature review which summed it up, there are 8 primary behaviors that are potentially associated with pain or at least stress in horses. So that's posture and weight bearing. So if they're not putting weight on a specific limb, then that's something to look out for. But horses do naturally lean to one, like if you're familiar with horses, they'll always have like a back foot without any weight on it. They're just resting. So you're mainly going to be looking at this in terms of gait. This is more lameness assessment. If you're staring at a horse and it's not putting weight on one leg and it's just standing there and relaxing, that's not a concern. Um, Limb and body movement, so that goes hand in hand with possible lameness assessment. For those that don't know, lameness is just not weight bearing on one leg. It's like a limp. There's head, neck, mouth, and lip movement, attention to specific body regions. So horses that are potentially colicking will really focus on their abdomen, and they'll start biting or kicking their abdomen. That's what this might refer to. Ear and tail movement, so pinning of the ears, swishing the tail, overall demeanor. Horses are able to have depressed like states, so they might look very withdrawn from their environment. They might just be staring off into space. There might be altered eating or drinking habits, and of course, vocalization. So these categories do provide a foundation for evaluating discomfort behaviors in horses, but it really relies on the context, as I tried to give some examples throughout. According to the Composite Orthopedic Pain Assessment Scale, there are also 4 distinct types of pain which correlate with specific behavioral indicators. So according to this pain scale, significant discomfort, you might see aggression. Acute pain, you might see restlessness and agitation. Pain, you'll see a rigid posture and reluctance to move. And during chronic pain, you might see a lowered head carriage and a depressive state, as I said. So they look withdrawn, they're not really engaging with their environment, with their friends, and just kind of standing there. And these behaviors do align with what other pain assessment methods have also found. So, for the horse chronic pain scale, they see a depressed demeanor, social withdrawal, loss of appetite, as I said. The ridden horse pain assessment or evaluation, sorry, they do observe aggressive behaviors such as kicking and bucking. For the Marin Smith composite pain scale, for colic or gastrointestinal pain, they see restlessness, pawing, rolling, frequent weight shifting. You might also see, as I said, focusing on the abdomen. But regardless of the content in each of these individual pain assessments, there are notable limitations to the practical application. So all of these are very specific to these types of pain. So if you are a veterinarian or a researcher, you have to choose the pain assessment method that aligns with what you believe you will be seeing. And that can, you know, lead to potential oversights in pain assessment because maybe the type of pain that you are actually observing is not one that is highlighted in one of these pain assessment methods. And also, not all of these behaviors are pain specific. So something like pawing or rolling, these are natural behaviors for the horse. Pawing sometimes is regarded as a stereotypic behavior. A lot of the time it's learned and the horse is being impatient or it wants something, it wants out of the stall, it wants its food, and it starts to paw. It's like an anxious behavior. But these are not specific to pain. So even if you're observing them, it might not mean that the horse is necessarily in pain. So that's the flaw with this. But in contrast, when you have methods that have poor or vaguely defined criteria, so in this pain assessment scale, no pain is just normal behavior. So when it's classified as such, you don't know what constitutes as normal, especially if it's not your horse. So this ambiguity can be especially problematic in chronic pain, where it these long-term behaviors that the horses are expressing is considered their normal behavior, even though they are in pain. And additionally, horses are frequently trained to mask negative behaviors and uh, discomfort expression, so they might not be displaying overt signs of pain or discomfort. So this suppression can make behavioral assessments less reliable, especially when they lack these obvious indicators. So, for example, we use bits in horseback riding. It creates more contact with the horse. It's a communication method for the horse to move in the way that we want to. But horses will often open up their mouth. And what riders interpret this as, or have interpreted this as, is a resistance behavior or they're being difficult. But what research has found is that this is a behavior that they're trying to expel the bit from their mouth, or they would do this if they had like a rock in their mouth, for example. They're trying to expel it from their mouth because it's uncomfortable for them. But we're seeing this as a form of resistance, or the horse is being annoying about it and not listening to us. And riding competitions do penalize riders for the horse displaying this behavior. So as a result, you might see nose bands that are tightened so tight that the horse can't open up its mouth anymore. And so then the horse learns that either there's no point in doing this behavior because it's not able to, or they're trying to avoid the punishment, which this might be even more uncomfortable to the horse than the bit is, so then they just deal with it. Now moving on to facial expressions, and this is where my specialty is. This is what my master's was focused on. There's two primary methods for facial expressions. So the first is the horse grimace scale, and this scale is, there are 6 parameters and you score them from 0 to 2. So the first is the ear position. So if the ears are stiffly backwards or ear pinning, you have orbital tightening. So that's referring to the eyelid. If the eyelid is closed or all the way closed, then that might be a pain indicator. You have tension above the eye. So if you recall the image that I used for my title slide, there was a significant amount of tension above the eye. It's referred to as tenting. So if you see that, prominent strained chewing muscles. So if you see the muscles on the side of the face, that means that they're clenching their jaw or maybe they're grinding their teeth. Mouth strained and a pronounced chin. So you can see the chin becomes significantly more rounded in each of the photos. This one's very hard to score, I will say. And then the last one is strained nostrils and flattening of the profile. So we can see in this first image, the muzzle is nice and round, but as the pain scale increases, it gets more flat, especially by the nose. The second method is the equine facial action coding system, or Equifax, and this is what I used for my research. And it's looking specifically at how the muscles move in the face. It's a lot more dynamic, but I'll go into the challenges after. But it's not as strict as a scale where you're scoring 1 to 2. You're really just saying, this is what I observed, this is how frequently I observed it, or how long I observed it, or you might just look for the presence of these behaviors. And I have some examples on the next slides. So I'm going to be showing 2 of the same facial action units, but this one is going to be a very exaggerated one. You'll be able to see how the muscles are moving, and then I'm going to show you an example of a subtle version of it. So this one is AU16, which is lower lip depressor. What you're looking for, you can see here, that lower lip is being manually pulled down by the horse. That is AU16. Compared to AU160, which is lower lip relax, this is when the lip is just hanging there. The horse is not pulling it down or manually moving it, but it's relaxed in the sense that the muscle just naturally hangs loose because the horse isn't keeping it pressed up against the lips. So a subtle version of this, and I apologize, because this came from my data set, I can really just zoom in on the lips, so it might be a little bit blurry, but you should be able to still see those same behaviors. So in this one, we can see the horse is pulling that lip down. It's very subtle, but the horse is intentionally pulling that lip down, so that is a lower lip depressor. Compared to this one, the lip is just hanging there. The horse is not actively moving it. So that is a lower lip relax. When it comes to pain assessment or affective state observation, there are several facial action units that are associated with stress or pain. So the blue one is the only one that has been observed exclusively for pain, and that's upper lip raiser, which is when the top lip is manually moving. The ones that have been exclusively identified during stress states include the head turning left, but that's important. You want to make sure that the horse isn't just looking at something behind them, or if something's happening behind them that they want to look towards. Nostril lift, so that's when it's self-explanatory, but the nostril kind of like jumps up or there's significant tension. You'll see wrinkles above the nose because the horse is pulling it up, and it will narrow the nostril profile compared to nostril dilator where it gets larger. Lid raiser refers to the eyelids, so the eyelids are getting more wide. Tongue show and lips parting, so that's when the horse is licking its lips or bringing its tongue out. That's what that's referring to. Chewing, and then sharp lip puller is like a twitch of the lip. So if you observe that, that might be a stress sign. And then, sorry, my cat is here. The facial action units that overlap with pain and stress, so it can't be determined necessarily if it's one or the other, is ear depressors. That's, as we said, when the ears flatten and they pin. Nostril dilator, inner brow raiser. So that's when the eyebrow is raised. That's that tenting that I mentioned earlier. Lip pucker, which is when the lips come forward, they protrude. It's just like a kissing face. Eye white increase. So you're not supposed to typically see the sclera of the horse. So if you see the eye whites, then that might be a pain or stress response. Chin raiser. So if you remember that pronounced chin in the horse grimace scale, chin raiser is when that chin pushes up and it becomes more flat. Blinking, half blinking, those are the ones that overlap. So half blinking is when the eyelid just goes halfway through the eye and it's not a full blink, it's self-explanatory. So if we were to take this photo of the horse, if we were to use the horse grimace scale, we might say, okay, the ears are starting to go backward. They're not fully back, so that might be a 1. There's significant tension above the eyes, so we can see the eyebrows raised. You can see there's strain around the temple. The eyelid is not closed, so that would be a 0. When it comes to flattening of the profile and the nostril, we can see that there is tension around the nostril. You can see some wrinkles here around the nostril, but the profile is not flat. This is quite a round face, so I would just score that as a 1. For the chin, I would also say a 1. It's still a little bit flat. It might become a bit more curved if it were a 2. And then for chewing muscles, we can clearly see these chewing muscles here. They're very engaged, so I would score that a 2. So overall, this would be a score of 7 out of 12, in which case we might determine that the horse is in moderate pain, or it's reasonable to assume that the horse is experiencing some pain. If we were to use Equifax, this might look like, okay, the ears are going backwards, possibly the ears are rotating, but I can't tell that from a still image. You have inner brow raiser, so that eyebrow is raised. You have lid raiser, where the eyelid is raised. You can see the eye white. There is a nostril lift here. You can see that this nostril is being pulled upwards. There's a nostril dilator, so the horses are dilating their nostrils, they're increasing their respiratory rate. You can see that because of the donut shape here. You can see that the perimeter of the nostril is actually kind of raised, so that's usually a telltale sign that there's dilation. You see lip pucker, so you can see that that top lip is pulled forward. That might be a lip pucker. It might be an upper lip raiser, but I can't tell from a static image. You're not supposed to be using Equifax with static images, but I felt that this was the easiest to show you what you might be looking for if you were to use this method. Also, you can't see chin raiser, or this would be sharp lip puller. It might be occurring based on what I would expect to see, and just based on like the shape of the mouth, but I don't actually know if this is happening. It might be possible. So aside from AU12, which hasn't been identified as a pain or stress response, we have 2 facial action units that are exclusive to stress, and then the rest overlap with pain and stress. So if you were using this method, you might say, okay, the horse might be experiencing pain, it might be experiencing stress, it might be experiencing both, but then you're also in the predicament of figuring out what AU12 or sharp lip puller actually means in this context, or if it really doesn't mean anything. If you're working in research, at least sorry, it's my cat. She's being quite annoying. If you're working in research, you do have your significant findings. So if you observed this a number of times, but it wasn't significant, then you're kind of off the hook. Maybe you don't have to talk about it. It was just a weird occurrence. But if it was happening and it was statistically significant, then you're in the position of, okay, there's not a lot of research on what this action means, and it might not have a behavioral function. So then you're put in the position of, okay, how can I interpret this? So Equifax is very good because it's dynamic, and you could be flexible with it. But when an outlier like that comes up, then you can be put in a little bit of a tricky situation. So then if you're using these assessment methods, and great, you identified that there's a negative affective state or the horse is potentially in pain, then what is next? What do you do with this knowledge? So you really just have to investigate what is happening. You're going to consider the behavioral context. So what is occurring when this behavior manifests, so that you can determine what is triggering this behavior and if you can fix it. You might use video surveillance. Horses do mask signs of discomfort, or they might be trained not to present it, especially in the presence of humans. So using video surveillance can help maybe observe some rare behaviors or triggers that you aren't aware of. And I would argue if you're going to be using facial expressions, they are quite difficult to do in the field. I would highly recommend just recording it. The horse has a very large face, but it's also not, you can only see half of the face at a time. So using video surveillance is very helpful for that. You might provide pain medication diagnostically. Pain medication and analgesics, they're not curative, and I wouldn't recommend using them when not necessary, because if you're using pain medication, let's say for lameness, and the horse starts using its leg because great, it doesn't hurt anymore, they're going to make that injury worse. So pain assessment is, or pain medication, sorry, are helpful and they should be used to alleviate discomfort, but not as a long-term management practice. And you certainly don't want to prolong the condition that the horse is in. So I would recommend using them diagnostically, because if you provide pain medication and then the behavior stops, then you know that, okay, the horse is in pain, now we have to treat it. And of course, doing the research, looking at what's out there, research evolves constantly, and you want to be up to date with how we can interpret these behaviors. And then once your investigation is done, then you can reflect and modify the practices either with your own horse or recommendations for the owner. All right, it's quite a big topic. As I said, I didn't have a lot of time to go into it, but I hope that it was still helpful and that you learned something from it. And I'll just quickly go through my reference slides. But yeah, I'm open to questions.
Nice presentation. I've never worked with horses. I'm learning a lot for the first time.
You- you're-
That was a
Sorry.
nice presentation.
Oh, thank you. Thank you. I
So
was worried it was a little
while we are
superficial.
still waiting for people to drop their questions,
Mm.
I have some questions for you that I've noted. What do you think is the main challenge, or what are the challenges in recognizing the emotional states in horses? Some
Mhm.
challenges in using these skills.
I do think that it's challenging. One, people are not educated enough, and I don't mean to say that in a negative way. Like it's if you don't know something, you don't know something. But I will say a lot of people purchase horses where the owner might say, this is a normal behavior for the horse. They've always done this. And if the horse has been presenting pain signs for as long as someone has owned the horse, then they might also believe, okay, this is a normal behavior. I don't have to be concerned. But that's not the case. So if they're not educated on how to identify pain and they believe that this is a normal behavior for their horse, then that's going to be overlooked. A challenge from a research perspective is the horse may not feel comfortable with you being there and might not present it. Or in the case that I had where there's learned helplessness potentially or learned suppression, then the horse may not ever present a pain sign to you, or discomfort. And discomfort might not necessarily have physiological parameters that you can rely on confidently. Um, and also, when it comes to owners as well, there's significant, at least in Canada, there's significant financial strain as well. So they might not be consulting veterinarians as often as they should because they can't afford it.
That's excellent. wondering if the age of the horse, the sex, and the breed will have any effect on feasibility of pain assessment. What do you think the role of sex, age, and breed would be on
Mm.
pain assessment in horses?
Yeah, so there is research that suggests that mares might be more expressive than geldings. They might be more socially dependent on their herd or their preferred companion, which means that they become more distressed if they're separated from them. There is also research to suggest that the management practices for mares do differ from geldings or stallions. Mares are seen often as bossy or yeah, or defiant, and that they're purposely trying to be annoying or defy you, and that can translate to harsher management practices, more restraint. Things like the noseband, for example, mares might be subjected to more of that, and their pain might be overlooked more than male horses because they're not recognizing it as a pain response or a discomfort response. They're seeing this as just the mare is being marish, and there's no need to be concerned. That's just how they are. But that's obviously a huge concern, especially with mares. But in terms of their actual expression, there's not too much difference. In terms of research, they might blink more. That's really the only thing that we have found.
That are related to pain. You talk about weight bearing, limb and body movement, attention to specific body regions, some movement of the tail, of the hair and tail, then, and a lot of things. So which of the behavior do you think is the most reliable when you are
hmm
assessing pain in
hmm
horses?
Since my master's was in facial expressions, that's where my answer is going to come from. Um, yeah, I would say the lip movements are the most telling. So chewing is actually a physiological response as well. So that's the body's shift from the sympathetic nervous system, so the flight or fight, into the parasympathetic, so rest and digest. Chewing does release dopamine, and it shows the horse trying to self-regulate into a calmer state. So I would say chewing is a good one. Lip smacking, the tongue coming out and licking the mouth, that's a good stress indicator. It's essentially for the same purposes as chewing. But then when you get into the smaller lip movements, so like the lip twitch, for example, that might be, it's been suggested that it might be a micro expression. And micro expressions, they manifest more when you're paying attention. So as the attentive state increases, the lip movements will increase as well. So if you're seeing a decrease in oral movements, then the horse might not be engaging with its environment, or it's not actively monitoring the environment. So when you see a decrease, that might be good. And if you see an increase in chewing or licking, um, the horse is trying to self-regulate and get to a calm state. So I would say focus on the oral movements, but in terms of ear pinning and the eyebrow, the eyebrow tension above the eye, those are kind of like golden. They're really easy to see. They're always regarded as a negative affective state, maybe not pain specifically, but those I would also look out for: the eyebrow tension and ears flatly pinned to their head, not just facing backwards. They might just be listening to something. If they are pinned completely flat, then you know that something's wrong.
Very much. We have a question from the chat. From It's asking if we can use irritational aggressiveness for assessing
Sorry,
pain.
I didn't quite catch that.
So she's asking if we can use irrational aggressiveness to assess pain.
Aggressiveness.
Yes.
Potentially, but you want to look at the management practices first. So aggression is actually not very common in wild and free roaming horse populations. They're quite amicable with each other. They do have hierarchies, But when resources are ample, they resort to flight. Like they will abandon their area and just find a new place to graze and a new place to find water. They're not very aggressive animals. Aggression in domestic settings might be a pain indicator, but you want to rule out first that they're not just being bullied off of the hay feeder or the water and make sure that they have access to those basic resources first before considering potential pain. But I do think that it's a good indicator as well.
Thank you very much. I'm looking at tail. Can we infer anything? What can we infer about pain from the tail?
So tail swishing, to be honest, it is considered a stress response. I haven't looked into what the function is, especially because horses use their tail to swat flies. So in Canada where we might have sufficient fly management, or they're using fly spray and traps, and there's not really a lot of flies, um, that might be more indicative. But I recently went to Mongolia to study horses and the wild horse populations. There's so many insects, and so they're bobbing their heads and they're swishing their tails, and it's really just because of the insect load. So I would say again, it's not a great indicator, but it might indicate that the horse is agitated. They do use their entire body to communicate with other horses, and research has found that these are valenced, and horses are able to, when they're presented a horse with a negative facial expression, novel horses or horses not familiar with that horse are able to identify it. So they use things like nostril flaring and tail swishing to indicate that they're agitated. And this is because they're not going to, even though vocalization is a potential behavior that you can look at in pain assessment or affective observation, horses don't really vocalize in the wild unless absolutely necessary, because they're not trying to give away their location. If they smell a predator through the wind and they know that it's nearby, they might start flaring their nostril or swishing their tail or running around to alert the other horses, hey, we got to move on. But vocalization is really just if they're already confronted, or if they're lost and they're trying to find their herd. So I think it does have merit as a behavioral indicator, but again, you have to look at the management practices first and rule out anything else that it might be instead.
So let's go to visits. My question is this: are there something like cross-cultural differences in how people interpret pain and emotion in horses? I'm a Nigerian now. Then we have
Yeah.
another person from China, another person from the US. Are there kind of differences in how these different cultures will interpret pain in horses?
Mm. I don't know if the interpretation is different. I am limited to English studies, and I don't recall seeing any papers, at least in my research, that came from outside of the Western world. I do think that there might be differences in education. So in Mongolia, for example, when they castrate the horse, which is when they neuter, they will bound the horse. They don't use pain management, and they'll use a hot iron to burn the testicles. And that's obviously very painful. We know that castration is painful in animals, but especially Mongolia is primarily nomadic, and they're becoming more connected, but in the past they don't have access to internet. They kind of are restricted to their communities because they have to travel quite far to reach other people. So just that lack of knowledge is what they might not know that this is painful, or they may not believe that it's painful. But when it comes to assessing pain, I don't think that it would vary. I think pain assessment in Canada would be the same as in Mongolia, but whether people actually believe what we find is maybe cultural.
So this is it. Thank you very much for that response. This is a personal question now.
Yeah.
How fast can I be trained to assess pain in horses? How
Mm.
fast can I be trained?
I think It's an ongoing process. As I said, research is always evolving. So even if you get really good at it now, a year from now, there's going to be more things out there that you can certainly learn. Um, in terms of like Equifax, for example, which is what I used, you can actually get certified in Equifax. They have an online training module that you can do. It took me about a month to get approved to do it, to pass the test. But I would say as I was doing my research and putting it in, you get better as you go. So you only need a 75% to get that certification for Equifax. I was like in the 70s, high 70s. But that still means that almost 20, more than 20% of the videos that I coded were not 100% accurate. So I think the 3 months that I spent on my research was a great amount of time to become very familiar with it, but I also looked at hundreds of videos. So it depends. I think you can get good at it quite quickly, depending on the amount of effort that you're putting into it. If you have a lot of test subjects that you can use and practice on, but I think a few months to get a baseline understanding and then just keep on top of the research.
Observer's training that will play a lot of role in identifying pain. One must be well trained to be able to do that easily. So let me check the chat box again. I don't
Mm,
have any question here in the chat box. So Avéll, thank you very much. If we have any of our participants that want to say one or two things before we go, you have free.
mhm. Yeah, sure. Yeah, I can wait around a little bit. I also
Do we,
have my email on the slide here, so if people have questions after the fact, they can email me. I'm happy to respond.
so if anybody, if you have any question and you want to ask before we go, or you have a comment, please let me know. You can signify by the use of raising up of hand so that I can allow you to talk. So some few announcements. I want to appreciate everybody for joining today's meeting. And if you are interested in watching our past webinars and inaugural lectures, you can watch us on YouTube. Just on YouTube, just type Animal Welfare Group Nigeria. We have more than 50 webinars that people can watch on stress, on neuroscience, archery practices, one welfare, and a lot of things in insects, in poultry, in wildlife, and a lot of other animals. And if you can also join us on our social media on X, formerly Twitter. Our Twitter handle is at AWGM14. At AWGM14. AWGN in capital letter and 14 in number. And our name on Facebook and LinkedIn is Animal Welfare Group Nigeria. So, Avéll, thank you very much for today's presentation. And I got a lot of things, and I know that our participant got a lot of things about, and we have somebody that is giving you a very big clap. Thank you so much. We hope when next I will call you to say something about horses, you're going
Mm.
to respond to us. Thank you. And to JPMP, thank you for joining us. Gideon, thank you. Zeno, Orioluwa, Rukayat, Favor, Jeremiah, Tosin, Olamilekan, Michael iPhone, Taufik, Benga, Shegun, Oluyemi, and every other person. Thank you. And I will see you another day. Have a thank you so
Thank
much.
you. Bye-bye.
Yeah.